Diagnosis of coronary heart disease represents one of the most diagnostic challenges in medicine. Today, we will summarize the steps of diagnosis. The story begins when a patient comes in complaining of chest pain or shortness of breath with minimal exertion. We ask them some important questions about the type and location of the pain. Is it felt elsewhere? Does it worsen with exertion? How does it go away? We also ask them if they have conditions that could increase their risk of developing it. The first thing we do after the examination is an electrocardiogram. Here we can encounter two problems. The first problem that the ECG has some changes that is normal for the patient but resemble coronary artery disease changes. The second problem that the ECG appears normal but the patient actually has a real problem. After that, we move to the second step, laboratory testing. The tests here serve two purposes. First, if the complaint is severe and there could be a serious problem, we perform a cardiac enzyme test, the most important of which is high sensitivity troponin. This is help us quickly determine whether there is a risk or not. The second, we request tests to determine if there are diseases that could affect the arteries, such as diabetes or high cholesterol, or diseases whose symptoms mimic those of heart, such as anemia or pulmonary embolism. After that, we move to the third steps, imaging, such as echocardiography and chest X-ray. Echocardiography gives us an indirect idea if a part of the heart muscle isn't moving properly, which could indicate a problem with the coronary arteries. After that, chest X-ray have a lesser role, but we use them to rule out other diseases that may cause symptoms similar to coronary heart disease. We then move to the fourth steps, the stress test. This is very important as most of the tests we performed were performed while the patient was comfortable, which could prevent us from detecting the problem. There are several types of stress tests. Stress ECG, the most common and the cheapest, stress echo, nuclear scan, stress magnetic resonance imaging. We choose the appropriate type based on the patient condition and the ability to exert effort, as well as the cost and availability of the test. Finally, we arrive at the two most accurate steps, diagnostic catheterization and coronary CT angiography. These are the only tests that directly visualize the arteries from within rather than merely providing indirect indicators like other tests, which makes them the most accurate. CT scans are useful when the probability of a problem is low, allowing us to rule out coronary heart disease to a large extent. However, if there is high probability of insufficiency, a catheterization is more accurate as it detects the narrowing itself and can also reveal other causes, such as increased blood viscosity. Besides, it has a therapeutic role like dilatation of the narrowing and inserting a stent to support it.